Apaxiban to prevent venous thromboembolism in patients with cancer. Definition: Apaxiban is an anticoagulant used to treat and prevent blood clots and to prevent a stroke in people with atrial fibrillation. Especially, it is used to prevent blood clots following hip or knee replacement, and it does with a history of prior clots. It is used as an alternative to warfarin and does not require monitoring by blood tests. It is taken by mouth. Application in medicine: to lower the risk of stroke and embolisms in people with non-valvular atrial fibrillation. Deep vein thromboembolism prevention. Deep vein thromboembolism prevention may lead to pulmonary embolisms in knee or hip replacement, surgery and surgery in patients, treatment of both DVT and PE to reduce the risk of recurring DVT and PE after initial therapy. Pros and cons. Apaxiban can increase the risk of bleeding, which may be serious and potentially fatal. When a spinal epidural anesthesia or puncture is utilized, patients who are being treated with antithrombotic agents for the prevention of thromboembolic complications are at a risk for developing hematoma, which can cause a long-term permanent paralysis. Pros: Apaxiban Eliquis prevents more acute strokes with fewer side effects. Apaxiban for reduction in strokes and other thromboembolic events in atrial. Issues apply in Ecuador. In Ecuador, Apaxiban is used for therapeutics of heart failure in other adults. Other application is for stroke prevention in non-valvular atrial fibrillation in public healthcare sector of Ecuador. Conclusion: Apaxiban is a direct selective factor inhibitor that is well tolerated when taken orally twice daily for the prevention of stroke in patients with atrial fibrillation and for the prevention of VTE following knee or hip replacement. The drug was found to be superior to warfarin in clinical trials in preventing thromboembolic events in patients with atrial fibrillation. An additional risk of strokes, the common adverse event of Apaxiban is bleeding, although the frequency of bleeding appears to be similar to that for warfarin. That potential risk measure bleeding is lower with Apaxiban.